The coroner's offices aren't always about death. We have to think about the surviving families and what the wishes are for the family and the loved ones that they lost. I think it's very important for the coroner's offices or ME offices to have a working relationship with organizations like LifeNet Health.
It's not just about my office, it's not just about what the tissue agency does, it's about the community and it's about those families that want to honor wishes of their loved ones.
The communication between the coroner's office and LifeNet Health is beyond what I expected. The team calls when they leave to come down to the office, and then they call just about 20 minutes out to let us know that they're getting close, so then I can ensure that I've got people here at the morgue to be able to let them in and do what they need to do for the recovery.
It's a very open line of communication. I can call on a weekend and know that I can speak with any one of those people and get the answer that I need. LifeNet Health is a great example of being willing to work with our office and understand where there might be some concerns about a certain case and being able to work through that concern so that donation can still occur, but we can still accomplish our investigation.
If it's a criminal case, a homicide as such, then my doctor will work with the recovery team on establishing timelines and the protocols that will be followed. And it might end up being just a partial recovery or no recovery.
I have realized as the Skagit County coroner that tissue donation is not a burden. It's not an inconvenience for us coroner or medical examiner offices. If anything, it is a great opportunity for us to be part of something much bigger.